Thank you so much for joining us today. I'm Cindy Shin, CEO of KACIE Strategies, and I've been hosting a series of these media roundtables on many different topics. And between COVID-19 and the massive protests, it's been a very hectic few months for all of us here, including our friends in the media. There's so much information, constant updates, and resources that need to be put out in the public, including information that will be discussed today on child abuse. Now, a lot of California and Los Angeles have been slowly opening up. However, many of the at-risk children are still out of sight of their mandatory reporters, the teachers and pediatricians, and there are concerns that abuse victims are silently suffering. So I'm very glad that you guys are all here for this discussion today, and I'm very excited to introduce you to our speakers today. Bobby Cagle is the director of the Los Angeles County Department of Children and Family Services. He currently oversees the largest child welfare agency in the nation, serving about 34,000 children annually, including 18,000 children in out-of-home care. Irene Lee is a deputy district attorney with the Los Angeles County District Attorney's Office and is currently assigned to the Family Violence Division, where she handles serious domestic violence and child abuse cases. Dr. Claudia Wang is a board-certified child abuse pediatrician who currently serves as the medical director of the UCLA Suspected Child Abuse and Neglect Team and oversees the team responsible for responding to all allegations of child maltreatment within the UCLA health systems. Thank you all to our panelists for taking the time out of your very busy schedules to talk with us today. Let's go ahead and first start with Director Cagle. Thank you again for being here. Let's first talk about the numbers. The reported numbers we've seen a drastic decrease in the number of child abuse reports during COVID-19. So what do those numbers tell you, and what are the dangers that at-risk children are currently facing during this pandemic?
So thank you very much, first of all, for having this roundtable. We are continuously analyzing data as a department to inform the work that we do. And certainly one of those indicators is the number of reports that we have come in. We know that our reports typically come by and large from three sources, one of which is our teachers and education personnel, the other is medical personnel, and then the third is law enforcement. What we've seen in this instance is about a half drop, 50% drop in the number of reports that we receive on a given day. And we further analyzed that and found that indeed what we are seeing is a drop in the mandated reporters, particularly teachers reporting on concerns with children. That is a very serious concern for us. It does, however, resemble the phenomenon that we see in the summertime when schools are out, but with a key difference, because we know in the summertime, kids typically are in summer camps or in other activities where other people are able to see them. And so the concern here is that we have families that are under a great deal of stress, even more stress than a typical family would be in. And we have less outlets for kids to have an opportunity to be outside the home and for people to see them. So what we've tried to do is really expand our outreach to our partners at the school systems, the LA County Office of Education in particular, to be able to try to offset that and to do more public education about the need for reporting, because we know that we can't start our jobs until the reports come in. We also are trying to educate on the fact that we are here to provide preventative services as well, hopefully to avoid ever having a child maltreated, and we have to get that word out as well.
How have you adjusted to this pandemic? Are you still continuing to do welfare checks virtually, or how does that work?
Yes, we have continued to make our face-to-face contacts with families and children throughout the pandemic. In our investigations area in particular, we have never paused that at all because of the safety issues involved. What we have however, done is to take a look at those cases that we have where we're working with families through issues, and also the kids that we have in foster care, to make sure that we're balancing the need to see the children with the need to protect both our staff and the children and families that we work with. To do that, we have done things such as use virtual visits, but in about 2/3 of the cases, we actually make contact with the children face-to-face and augment those with telephonic contacts and also virtual contacts through things like FaceTime, Skype, and WebEx.
Now, well, hopefully children will all be able to, of course, return to their schools one of these days and be with their teachers and their peers sometime soon. So especially times like this, public vigilance is even more critical. Can you tell us about your PSA and about the outreach work that you're doing currently, especially in the ethnic communities?
Absolutely. So we are working with the LA County Office of Education to make sure that we're doing outreach within all 80 of our school districts in LA County. I've said in the past that being the 2 largest agencies of our type in the country, it is really incumbent upon us to always redouble efforts to work together. Part of what we've done is produce a PSA where we talk to the public and to educators about the need to report about the signs that children may be abused and neglected, but to also offer to them the preventative services that we spend about $20 million a year on in this county, where a prevention and aftercare provider, a community-based organization, can actually reach out to families without our agency ever having to go to the home. Those are things that we're continuing to work on. Dr. Eduardo and I at the LA County Office of Education have just done a joint video that will be used for all educators in the county to encourage reporting, but also talk about the need for us to partner very closely to assure that children and families have the things that they need to feel supported and to also be ready to learn when they do come back to school.
I understand that you've also been able to translate your PSA into many multiple Asian languages.
Yes, that is one of the things that we're continuing to work on. We have already translated into a couple of different languages, Korean and Spanish. We're working also on getting those produced in Chinese, Japanese, Vietnamese, and Tagalog. And I hope I pronounced that last language correctly.
Yeah, I think it's Tagalog. But actually, I think it's actually on your website right now.
Great.
Yes.
Fantastic.
Yeah, I just got that notification from your press deputy. So they were translated and they are up on your website already. So that's great news to hear. And who can you explain to us who can call this hotline, and what is the process once a call goes through? Does that go straight to DCFS, or what is that process?
So the call to our hotline is to a group of our employees that are there 24 hours a day, 7 days a week. They take the call in, they look at the circumstances described in the call, and they try to determine whether an investigation is in fact needed. Oftentimes what we get is a need for just resources. And so part of what we're trying to do is direct those calls to our community-based organizations to assure that we're giving families what they need without the threat, the intimidation often that comes with a child abuse investigator going to the home. However, we also know that there are instances where we need to get out and check on the welfare of children immediately. We have staff that do that 24 hours a day, 7 days a week, do that in conjunction also with law enforcement for the more serious calls. That is the way that we handle in excess of 200,000 calls a year.
And lastly, can you talk about the importance of foster parenting, especially during tough times like this?
Absolutely. Foster parents are a key to our system because not all children can safely remain with their own families. We try our very best to assure that we get children with their own family members if possible. But there are those cases where we cannot do that. And what we have to do then is depend upon those in the community who want to be a part of our system to provide a safe, loving home for those children. During a time like this, we luckily have seen people still stepping forward to be a part of the system because they know the need is there. And in particular, we've had families step up to say, we will even be there for COVID positive youth because the need is so great. And so that is an essential part of our system that without we would have a very tragic circumstance indeed. And so we're so thankful for our foster parents and all that they do to help support our system.
Right, thank you for that information. I'd like to hear from Irene Lee now with the District Attorney's Office. Now, we talked about the numbers, the number of reports decreasing. How has it been at the District Attorney's Office? Are you receiving less cases, more cases? And I know that you can't talk specifically about the cases, but what types of child abuse cases are coming your way?
So we haven't seen any drastic drop in terms of the number of filed cases, but we did run the numbers in terms of the reported cases. And just so that I'm accurate, the period of March 13th through March 31st of this year, there were 1,860 reported reports of child abuse to the hotline. And last year, during that same 2-week period, there were 3,200 or 3,201. So it's close to the 50% drop like Mr. Cagle had talked about, which is very concerning. In terms of the filed cases, we haven't seen a very statistical difference, but we do still see serious child abuse. During this period of time, during COVID, I myself have filed cases involving child fatality or close to child fatality. We do see instances of DUI involving children, so where the DUI suspect has a child in the back seat and it could cause either physical or mental or both types of harm. So we're still dealing with that. Excuse me. In the city attorney's office, I inquired of them. They're not seeing much of a difference in terms of their number of filed cases. But again, we're concerned based on the SCAR reports, the reports made to DCFS, that there is such a significant drop.
And what is the response been at the District Attorney's Office on COVID-19? Any types of outreach or community partnerships that you guys are currently doing?
So we already have some very strong community partnerships. We have partnerships with the child advocacy centers in West Covina and in Orange County, where they give us access to conduct forensic interviews of children. We have LAPD has what's called a Family Justice Center, which I'm sure everyone here is familiar with. And they have detectives specially trained for domestic violence and child abuse. They work a lot with Casa de la Familia, sorry for my pronunciation, Casa de la Familia. And I'll put up a pamphlet shortly. And they have Spanish-speaking resources for families that are dealing with domestic violence and child abuse. We are also working on a partnership with KFAM, Korean Family Services, and they also provide a unique resources for Asian families. They're one of the only organizations that are able to provide foster care for Asian children. So we're working on a partnership with them. And we also have, various local partnerships with the different police departments. And even in the DA's office ourselves, we have a special room for children of physical and sexual abuse, so that when they come and they're getting ready to testify, they can feel comfortable. It's a safe space for them to sort of put them at ease before they have to go into the courtroom.
And any of the in-language resources that you are able to share with us today in the chat box, did you?
I will put that in just one moment. And we also have pamphlets in English and Spanish. We do need to work on the Asian languages.
Well, that's a great opportunity to ask for partnerships. And you mentioned domestic violence. Last month we had a roundtable on domestic violence, and we had the mayor's office, the city attorney's office, LA County Public Health, as well as community organizations coming out and talking about this. And I understand that with domestic violence, it often comes hand in hand with child abuse cases, but also, even if it's not physical or emotional child abuse, I understand that there's also that psychological impact on children who are witnessing domestic violence. And Irene, can you talk about that?
Yes, there have been studies done, and a child who witnesses domestic violence, they will have a severe impact on their brain. The brain scan does show that there is an impact, and they will experience oftentimes issues with learning abilities to cope. So it does have a detrimental impact on them. And oftentimes we do see that if there's also some type of child abuse, whether it's physical or neglect, or just the constant exposure to consequences that causes them serious concern.
Okay, thank you for that. I'd like to hear from Dr. Wang now. As mandated reporters of child abuse, now that you have less opportunities to be face-to-face with children and detect, report suspected abuse, and due to the fact that there's a chance that it may not be being detected early enough, are you seeing more severe cases of child abuse coming into the hospitals currently?
So currently, looking actually across the country, I'm in touch with my colleagues. While there has been some anecdotal reports of a few institutions or hospitals having an increase in severe cases, many others of us are not. What we have actually seen is cases of severe physical abuse will wax and wane. So there are good weeks as well as bad weeks, unfortunately. What we have seen, though, in this meantime, it's been similar across the country. We have seen increases in poisoning. Poisoning with such as cleaning agents, where families are doing a wonderful job actually cleaning surfaces with agents. However, having that challenge of supervising an active toddler at the same time. So poisonings have actually been an uptick, and that has been also seen across the country. Another thing that has been seen, speaking with a colleague at a burn center, an increase in some burns as people are at home and cooking more at home. So spills with hot liquids or things on the stove actually have been seen. So in this category, these are accidents, but some of the more severe ones could be fall under the category of supervisory neglect. So those have been seen. One thing that has been mentioned has, as previously, an uptick in DV or domestic violence. Something that has been seen with the National Sexual Assault Hotline is an increase in number of children making reports. And in March of 2020 was the first time where actually over half of the calls were children to the National Sexual Assault Hotline. And out of those cases, 79% reported living with the perpetrator, and 67% mentioning the perpetrator was a family member, such as a parent or a sibling. So there has been a concern about sexual abuse, as well as online predators, because when kids were sheltering at home, a lot of them were on their electronics, and of course, unfortunately, have online predators lurking. And if families are not able to closely monitor their kids' activities online, these kids are at risk.
And how are pediatricians and other medical staff adjusting or adapting to all of the COVID-19 restrictions? And how are you conducting those wellness checks or those well child checks?
Right. So, of course, the clinics had remained open, the hospitals had remained open. However, the visits for well child visits and sick visits, of course, declined. So fortunately, physicians were able to ramp up actually telehealth and being able to virtually connect with patients at home. So this has helped tremendously. However, it cannot replace an in-depth in-person visit where a physician can, completely undress a child and really get a good detailed physical exam on a child, especially for cases of child abuse. The other thing is interviewing children have been challenging at times. Of course, if you are concerned about non-accidental trauma in the office, You can request a private interview with the child. Of course, with telehealth, that's virtually impossible at home with caregivers in the same room. So it has been challenging. It's difficult on a telehealth call to, to visualize a bruise. You can imagine the challenges, the lighting, the cameras. A shadow may look like a bruise, and it's really hard to and to be able to depict it. And again, you do not get a complete exam on the child, so it can be quite challenging and difficult.
What about when you're dealing with children with disabilities who are non-mobile or non-verbal? I can imagine there are more difficulties when it comes to that.
Absolutely. Non-mobile infants, it's really concerning. Verbal children, as well as children who with disabilities, you primarily rely on the physical exam because they can't provide you that history. And again, virtually, it's just too challenging to really be able to provide and perform a very detailed physical exam on children.
Something interesting that Dr. Wong, you had mentioned during my conversation with you is the cultural practices in some cultures that could sometimes lead to suspicion of child abuse. And can you talk about that and the education that you're doing to try to prevent that?
Right, absolutely, thank you. So yes, actually, in Los Angeles County, we have a very rich and diverse cultural population. And so many families are fearful of coming into the hospital, to the emergency room, and getting exposed to COVID-19. So that many families with their elderly grandparents may be providing folk medicine practices to heal family members or to heal their child. And some of these folk medicine practices can mimic actually child abuse. Some practice can lead to bruises or actually burns, and it can be actually quite confusing to the healthcare practitioner. And so we have seen it, and we actually, when we realize that of course it is a cultural practice, then we provide education to families. Usually DCFS asks us not to report, but to educate families of various cultural practices. And there's many different types that are performed amongst the Asian community, as well as other different communities as well. So it's really important for us to be, cognizant of, racial or cultural differences. And along those lines, we also need to be cognizant as healthcare providers and mandated reporters to be ever mindful of the potential for implicit biases in our work, and perhaps being with racism. It's important for us to take a look and ensure that the influence of race doesn't influence us in the category of when we are making reports or when we fail to make reports of child abuse and neglect, because child abuse, it crosses all groups, all races, ethnicities, and socioeconomic statuses. So it's really important for us to be aware.
Yeah, thank you for that, especially with everything that's going on right now. If any of our speakers wanted to add anything on that issue, please go ahead as well.
Issues around overrepresentation of minority groups in the child welfare system, and certainly that is a major concern for us. And we know that if you look at our system, the overrepresentation actually begins at the report stage. So for instance, African Americans are reported at 4 times the rate of their presence in our population. And so we're beginning to look very closely at the questions that we ask, but also how we interpret the information given to us based upon things that are potentially ethnic or culturally related. We also are looking very closely at the attitudes of our own staff. I have engaged myself in a lot of training trying to understand implicit bias in a different way, because I do believe that each of us carries biases that can translate into a situation where we're treating others in a way that they should not be treated. And so we're having to look very closely, just as the police are in the current conversation. We feel that it's important that we look at our system in a very critical manner to make sure that we're treating everyone with a equity lens, with justice in mind, and for the truth to be the basis of what we're trying to do. Anything less than that is a disservice to the community. And so we're determined that we're going to figure out ways to get to the issue that we're talking about, because it's undeniable that it's present in our system.
Thank you for that. Is there anything else that our speakers wanted to add before I turn it over to the reporters for questions and comments?
Well, one thing I wanted to add about our, we're working on a partnership with KFAM, and they have primarily resources for Korean, Tagalog, and Chinese. And I think it's one step forward to understanding some of the cultural differences, because they're able to provide advocates and workers who are very familiar with those cultures, who speak those languages fluently. And I think that when you're dealing with child witnesses or child victims who are most comfortable with that background, it only helps to bridge the gap to have people trained to speak with children who are also of that same cultural background. So we look forward to that partnership in the DA's office.
Yeah, that's absolutely right. That's one of the reasons why I also do these ethnic media roundtables, is because, you know, it's you know, you have to work with the ethnic media as well as the community organizations, and who actually know those communities and the backgrounds and the culture. So it's very important to have those partnerships and to have discussions like this. So thank you for bringing that up. I'd like to go ahead and open it up to questions to our reporters.
On the Filipino channel here, I guess for anyone to answer, are there any like cultural, especially in ethnic media, are there any cultural stigmas that you guys notice when it comes to reporting these things? I mean, especially now that a lot of us are cooped up, a lot of Asian families have multiple tenants in one house. You could have like 40 people living in a 3-bedroom house. Yeah, are there stigmas or cultural challenges that you guys are expecting or are facing as we trying to navigate child abuse during the pandemic?
A couple come to mind for me. First of all, I think there are many cultures that feel as though the family should be able to handle the issues within the family. And so making sure that we are putting out information that is culturally relevant, that is speaking to the concerns that those families may have, but also being able to provide services through organizations in the community that really are culturally competent is a real focus for us. We also know that, unfortunately, some of the immigration debate that goes on has made people even more reluctant to call because of concerns around immigration status. Those things are things that we constantly deal with and try to make inroads on to a greater or less extent.
Yes, I would also.
Oh, go ahead, sorry.
Go ahead. Say to you know, seek out the healthcare providers. The pediatrician, your internist, the family practitioner, other individuals that may be able to assist and help provide, as what Mr. Director Cagle said, you know, additional services and resources. If there's, you know, financial issues, I mean, with, you know, food insecurity, you know, housing instability, you know, things like that, that there are actually resources that can be provided, as well as if you find, you know, other stressors in the home that are coming into play during this, you know, pandemic, and such as if there's, you know, someone, you know, drinking more alcohol or using drugs, or if there are stressors which are leading to more towards intimate partner violence and things like that. Again, there are, you know, resources out there that can be provided to help the families.
Right, and I was going, excuse me. I was going to add that, like I talked about earlier with KFAM, they provide not only child abuse like counseling services, but they have a full breadth of domestic violence help. So if there are organizations like KFAM, I added the flyers in the chat box so that the families do have other resources to rely on to get the help that they need that's culturally sensitive to their backgrounds. And when you have people who are trained to speak the language, who understand the cultural background, then that should help to have them communicate, if necessary, with law enforcement or DCFS or whomever, or even with their physicians if they need that help to communicate in the medical field as well.
Well, thank you everyone for joining today. And thank you once again to our speakers for taking the time. I know that even our reporters, everyone is very busy these days, and I appreciate you all joining in for this conversation. And for the reporters, remember to download all the information from the chat box. And Dr. Wong, go ahead. You wanted to add something?
Right. I may add just a couple of other things, actually. So for healthcare providers or and the pediatricians, one thing that may help you actually in your office practice, especially as you're opening up, pediatricians are familiar with the ACE study, the Adverse Childhood Experience Study, and so they can actually, their screenings, those ACE screenings are occurring. And at this time, Medi-Cal actually is reimbursing healthcare providers for screening, eligible providers for screening the Medi-Cal patients. And this screening can actually open up your door to, or your window to see which families are in need of additional resources, which ones do have stressors occurring within their home. And this actually can be helpful for all patients. I think everyone's familiar with our California Surgeon General, Dr. Nadine Burke-Harris, who is actually providing resources and training in this area. And I think that will be a very useful tool for all pediatricians. I'll put my plug in right now also for families really should be coming back to their healthcare providers. And especially in the population of children, that they should be coming back. It is safe. We're here. Everyone's been doing a wonderful job in preparing. And so it is safe to come back to get your kids immunized, especially the physicals and immunizations for your school-age kids prior to school opening up in the fall, as well as our infant population who really desperately need all their immunizations because they are very susceptible to many childhood illnesses, and these vaccines are safe and effective. So families it's important to get their kids back in. Thank you.
Yes, definitely. Thank you so much, Dr. Wong, for bringing that to our attention, for sharing that information. If anyone else would like to add anything, if not, should I go ahead and conclude? Thank you so much, everyone, for joining. And once again, please remember to download the information. I'll keep this this meeting open for a little bit, just so you guys can come back and download if needed. So thank you very much. I appreciate it. If any of the reporters have any questions, just go ahead and call me, email me. There are also a few people who weren't able to join who had RSVP'd, so I'll have a rough cut of this video, and I can share that with all of those reporters to use it for their stories as well. Thank you once again, and I hope to see all of you again for the next roundtable. Thank you.
Thank you, Cindy.
Thank you.
Thank you.